Good morning. First of all, I would like to thank Dr. Antonagannakis, Dr. Berlakis, and the organizing committee for this kind of invitation. We're going to present the biological enhancement of rotator cuff repair. The augmentation options are PRP, platelet-rich plasma, mesenchymal stem cells, and local innervation as microfractures or vented anchors, and collagen tissue scaffold. We're going to present for the first two options here. As we know, PRP is an autologous human plasma where platelets are in great concentrations and comes from the patient's own blood. PRP is rich in growth factors, in many growth factors, and cytokines. And a recent study showed that tenocyte proliferation rate is higher when cultured with platelets-released growth factors, and tenocytes can be stimulated in case of chronic cuff tears. So when platelets are activated at the site of injury, many growth factors are released, and this leads to good healing and tissue regeneration. PRP has many advantages, as we know. It's an autologous biological product. We can easily prepare it, and seems to have minimal complications. And most of all, it has a wide range of actions in many and different parts of the human body. There are high-quality evidence that support the use of PRP in cases like lateral epicondylitis or osteoarthritis of the knee, moderate evidence in cases like patellar tendinopathy or plantar fasciitis, and insufficient evidence for diseases like Achilles tendinopathy or osteoarthritis of the hip joint. But what about augmentation in rotator cuff repair? Over the last decade, there are several studies that conclude the combination of PRP and surgical tendon repairs can significantly improve tendon healing and reduce RCR rates and pain. A meta-analysis of 18 randomized controlled trials with over 1,100 patients that was published in American Journal of Sports Medicine in 2019 conclude that PRP in rotator cuff repair resulted in improved healing rates. It reduced the pain levels and has better functional outcomes. Also, PRF, platelet-rich fibrin, resulted in a significantly longer operation time. Another recent study in 2023 with 10 randomized controlled trials and over 600 patients conclude that compared to arthroscopic rotator cuff repair alone, the application of PRP reduces RCRs and improved clinical function scores, where the application of PRF has no clinically meaningful benefit. They also find that heterogeneity of studies, as well as methodological limitation and the risk of bias, limit confidence in the true effect of PRP. In another study published in 2016 arthroscopy, they concluded, on the other hand, that PRP did not improve overall RCR rates or outcome scores, only some superiority in small or medium-sized tears versus large and massive tears. Also, heterogeneity in terms of surgical fixation techniques, performance of acromioplasty at the time of surgery, and preparation and means of administration of PRP. So, is the use of PRP cost-effective? The answer is we don't know. There are studies that assume if we assume that the mean cost of a PRP treatment is $750, a reduced rate of at least 9.1% before the additional cost would be considered as cost-effective treatment. So, is there a treatment protocol in which PRP is effective? We don't know, but we know for sure that growth factors in PRP, when obtained from human and applied after 2 minutes, have decreased bioactivity. So there are 4 main PRP groups, but we don't know which is the best. So there's a call for standardization in PRP preparation protocols. A systematic review of the literature between 2006 and 2016 contained 105 studies. They found that only 10% provided enough details for the preparation protocols, and only 14% provided quantitative metrics of the composition of the final PRP product. So a precise, detailed description of the PRP preparation protocol is required to allow comparison among studies. The other option is stem cells. Stem cells have 2 main features: the ability to differentiate and the ability of safe renewal. At the site of extraction for bone marrow is tibia or posterior superior iliac spine, iliac crest, and humeral head. And for adipose cells, abdomen, buttock area, or infrapatellar fat pad. Adipose stem cells have a high proliferation and differentiation capacity. They are less affected by donor's age, and they have multiple times more stem cells in the same volume than bone marrow. But they have lower chondrogenic potential. On the other hand, bone marrow stem cells have high chondrogenic and osteogenic potential, good expansion ability, and, but the harvest site affect quality, and they seem to be affected also by donor age. In this publication, there was a study between 2 different groups. The first group underwent single row repair, and the second group single row repair plus biological augmentation with iliac crest stem cells. And they found that biological group had the intact rotator cuff by 87%, and without augmentation, the group had intact rotator cuff by 44%. This is 10 years follow-up with ultrasound and MRI scan. Another similar publication studied 2 groups, 2 different groups. The one who had medium to massive rotator cuff tears. The one group had only arthroscopic repair, double row repair, and the other group had arthroscopic double row repair plus an injection of adipose stem cells loaded in fibrin glue. So the injection group had lower retear rate by about 14% at 14 months postoperatively. Another recent study said that 760 patients had either PRP augmentation or bone marrow augmentation, and they compared with another group without augmentation. And the application of bone marrow at the time of cuff repair was associated with a significant decrease in the incidence of revision surgery. There was no effect of PRP on the incidence of revision surgery. So, in conclusion, we can tell that biological enhancement of rotator cuff repair seems not to have any important side effects, which is very important. In large and massive tears, it may be cost-effective, especially in Europe, where the prices are lower. They seem to reduce retear rates in most of the published studies, but don't forget that the local techniques can enhance also the biology. PRP, to disperse and diverse data, not easy to reach a safe conclusion. Stem cells seems to be more promising. So what we need is more data and less diversity in order to standardize the preparation protocol and provide reproducibility. Thank you.